We are all taxed for the uninsured. Every one of us in this audience pays approximately an extra close to $1,500 per person. So we're paying for this. Just by wiping that out, our premiums are going to go down dramatically. That will help pay for this whole system. The public option plan is a necessity. We have a public option plan that takes care of approximately 50% of the people in the United States. It's called Medicare and Medicaid, and it works beautifully. I have never heard of one person that they're so thrilled when they turn 65 because they want to go on Medicare. And we can go and see any physician we want. We're not denied any care. There's no gatekeeper there. It's a wonderful, wonderful system. By the way, the overhead on Medicare, as I've read, is about 3%. The insurance companies are 30 to 40%. That will pay for this whole system. It's that simple. Who does not want this? Well, it's no secret. The insurance companies don't want it. Why? William McGuire, the CEO of United Healthcare, what did he make last year just in stock options? Does anybody know in this room? $1.6 billion. $1.6 billion. It is unconscionable. It is unbelievable. This one man, if he would take $100 million, I could pay for all the uninsured in Missouri and several more states. It is that simple. Leonard Schaefer, the CEO of Blue Cross and Blue Shield, 2004, salary and bonus, $337.5 million. Let the people in the United States know this, and you will pass this bill so quickly your head will swim. I'm telling you, let the United States know what's going on. And then on top of it, they deny care to all my patients. And I have to be filling out papers trying to get these people insured. I do Fox 2 Call for Action. I take care of all these people down there that have lost their health care. It is unbelievable what is going on. How else do we fix this system? I'm going to tell you something that no one wants to talk about. It's in the coding system. It is the biggest fraud. It is the biggest ripoff that goes on to the United States. It affects physicians, hospitals, nursing homes. I can speak, there's thousands and thousands and thousands of codes. Nobody knows what's going on. I'll give you a couple examples of how this works. I can sit down and describe this whole system. It is the biggest fraud in the world, what goes on. I send a patient comes in for an outpatient to a hospital, needs a chest x-ray. Hospitals don't pay for admitting chest films. What does the hospital tell us to do? Because they want to get paid. They say, code it SOB, shortness of breath. We used to do it all the time. The hospital got paid, we got paid. A patient comes into the hospital, they code it inpatient instead of outpatient. It's worth tens of millions of dollars a week to a hospital chain. Tens of millions of dollars, nobody knows this. A podiatrist sits over in the JCC in an office there cutting toenails. The only problem is Medicare does not pay for cutting toenails. This is right where I go, the Jewish Community Center. He codes it an ingrown toenail. He codes it a fungus disease. Medicare is paying for cutting everybody's toenails in the United States. I have a little article in my wallet from the Riverfront Times just 2 weeks ago. A podiatrist was caught coding for people doing complicated foot surgery, and he was an amputee. I have only given you 3 examples. I can give you thousands of examples of how this coding. How do we fix it? Very simply. Have a compliance officer in every hospital, every nursing home. Make the CEO responsible for what the compliance officer tells them. and then this will not go on. Because if he knows he's going to jail, he's not going to allow it. Right now they know they're going to get a slap on the hand. The government's not going to close down their office, and even if they get fined, they're still way ahead. It is that simple. We're talking tens of millions of dollars a day in hospitals in every city, every community. I guess that's enough. I can speak to you for hours about this because I know the system. I'm telling you what nobody else will talk about.
Doctor, thank you. Thank you so much. I want to thank you. I want to thank all of the people that gave such powerful and personal and constructive testimony here today. I want to thank the professionals up here that have shared their expertise, like so many experts in the healthcare field here in St. Louis. I will take your ideas, your enthusiasm back with me on the airplane here in about an hour. And we have votes later on today. Please stay around, visit. I have some staff here. If you have any other questions, follow up, please. I welcome your input. These kind of forums are very, very important to me and the work that I do on your behalf in Washington, especially this historic opportunity to fix our broken healthcare system. So thank you all very much for being here and sharing this time.